There was a medication that I was handling at an emergency clinic that I was working at that I didn't realize until I had started to do some research was actually extremely high risk. And we use it in veterinary medicine a little differently. It's a stomach protectant, but in human medicine, it is actually used to have an assisted miscarriage. There's common risk factors that most people would think. Anaesthetic gases is one. Sometimes these things can get missed or not be up to date in the smaller practices, which can increase your risk of miscarriage. Radiology, obviously we know exposure to radiation in pregnancy is not ideal. There's also a lot of zoonotic diseases that can compound that pregnancy risk factor for miscarriage if you're not taking proper precautions.
Welcome back to the Paws Effect Podcast. I'm your host, Dr. Cara, and I'm so grateful that you've joined me here again today. If you're new here, please take a moment to subscribe, rate, or review us. It really helps others find the show and benefit from these conversations. Today, we're talking about a subject that is deeply personal, but still far too often left unspoken in our profession: miscarriage and pregnancy loss amongst veterinary professionals. My guest is Heather Ashcroft, a veterinary nurse, writer, and advocate who has co-authored an important piece shining light on pregnancy loss in vet med. Together, we'll explore why miscarriage needs to be acknowledged more openly in the veterinary world, the toll it takes on those who dedicate their lives to caring for others, and what we can do, colleagues, leaders, and friends, to provide meaningful support. This conversation is about breaking silence, lifting stigma, and reminding one another that behind every veterinary professional is a human being whose well-being matters. A warm welcome to the Paws Effect Podcast. Thank you so much for joining me. I know we're going to tackle quite a sensitive topic today, so I'm really grateful for your time.
I'm happy to be here, and I think it's definitely a subject that needs to be talked about more, so thank you for addressing it.
Oh, no. So before we begin, Heather, can you share what moved you to co-author this article and what it really means to bring such a personal topic into the open?
Yeah, definitely. I come from personal experience. I experienced infant loss during my time working in clinic. I was actually working at an emergency hospital locally. And just navigating through that was quite difficult. And being a women-dominated industry nowadays, it's a very common issue that I found my coworkers were dealing with, and in some ways, I felt like it wasn't being addressed. And it was actually Jackie who approached me about writing this article because of her personal experience and also seeing the need to really bring this out and be able to talk about it publicly and try to give these women a voice, really.
But miscarriage is common, but it's really spoken about in the vet space. So why do you think it remains so hidden? What is the reason behind the secrecy?
I think, honestly, the way that a lot of the culture is in veterinary hospitals is, we deal with tough stuff every day. The job is extremely emotionally taxing. It's also physically taxing. And I think there is kind of a grin and bear it mentality to a lot of the work that we do in veterinary hospitals. And that translates over into, personal losses like losing an infant.
So is this the culture of resilience that we've always tried to cultivate, carrying on and we're so practiced at it with the kind of work that we do?
I think so. I think there's another facet too, because vet clinics typically, they don't have additional staff members that are able to kind of jump in and take over. So there is that kind of obligation and responsibility and not wanting to let your team members down too. Even if you need to take some time or you need to navigate through grief, it's very difficult to be able to advocate for yourself, be able to verbalize what you're going through in a way that is not shamed. There is definitely a stigma to, being open about these subjects. And then there's the feeling like you're letting your team members down.
Absolutely. And I suppose we see this in illness. This is obviously an extreme end of what we're discussing today. But, even when you're not feeling well, you have a bladder infection, you have the flu or you've hurt your back or something, there very much is the expectation that you just keep quiet and carry on. Medicate and you're there.
Yeah, like you said, it's the resiliency kind of culture.
Yeah, very much so. From a physical perspective, what do veterinary professionals need to sort of, in terms of the realities of a miscarriage and some of the consequences and the things you have to deal with afterwards? Discuss some of the physical aspects that you suffer. I mean, we will obviously, or most people can imagine the psychological ones, but we'll get there. But let's talk about it physically.
Do you mean in relation to experiencing infant loss or in a clinic specifically?
I think in relation to experiencing infant loss, either while working or even having to go back, because we know this is not something that is just, it happens and then, you're back to work and you're feeling physically well immediately afterwards. Take us through that, especially as you've had this experience, if you're comfortable doing so.
I think there's obviously a physical aspect, right? Your hormones are kind of off the charts. You're very early in pregnancy. There's a lot of mental factors as well. Lots of big changes happening in your body. With actually experiencing loss, it can be extremely painful physically. There can be a lot of blood loss. Depending on where in the pregnancy you experience loss, really depends on the severity of the physical effects as well, because obviously later term in the pregnancy, there can be more serious consequences, more medical interventions required, and more hardship. But even early on in the pregnancy, it can be very difficult to go through something like that and just be able to operate as normal.
Absolutely. I mean, if you are experiencing it, and we've heard some heartbreaking stories of people not being aware of actually experiencing the loss in the workplace, and then feeling like they have to return the next day, feeling dreadful. I mean, from headaches to, as you said, physical signs like blood loss to nausea. I mean, because those signs from a hormonal perspective do not go away immediately.
No. And you have increased blood flow as well. So you can have issues with migraines. Obviously, very severe cramping is another side effect. So it can really affect your physical ability to do your job.
Yeah. And from a mental perspective or an emotional perspective, what kind of toll can this take on someone working in such a demanding or caregiving role?
I think it is especially difficult for people working in veterinary medicine because, as I said, our job is extremely emotional. We are dealing with very difficult situations every single day. We all got into this profession because we love animals and we want to help them, and we love their caretakers and want to be able to support them. But often that comes at the expense of our own well-being, and that gets compounded after a loss as large as infant loss. So it elevates that emotional factor. So when you have your typical cases, your difficult things, your hard euthanasias, your hard diagnosis, that client that can't afford treatment, that you have to help navigate through that process of finding a solution for their pet. It gets compounded because your hormone levels are through the roof. You're already extremely sensitive. You're very emotional. And these little things that typically you may pride yourself, like myself, in being able to navigate them with ease and having skills in being able to connect with people and really help them through these difficult situations where it can really throw you off and send you into really questioning, what am I doing here? Am I really able to help these people? Because, you haven't dealt with the issue of your own grief.
And how might returning to work too soon affect you from a healing perspective, both physically and emotionally?
We all know rest is very important. Being able to take the time to process, whether that is taking the time on your own, whether that's being able to talk to someone close to you, whether that is, pursuing more medical care or treatment. It really is vital to be able to, as I said, be able to put your own grief aside when you can go back to work. If you haven't dealt with it, you aren't really able to put that aside. It will sneak out. It will come out in the ways that I said, where you're really not able to do your job to the fullest, and it can cause even more stress because if you haven't dealt with those emotions, they'll just compound with the other things you're dealing with on a daily basis over and over again. And then from a physical standpoint, the risk of injury is always there, especially working with very large breed animals. And if you're not on your game, as they say, if you are preoccupied, if you are still feeling discomfort, if you're having physical signs and symptoms, then it can put not only yourself at risk of injury, but it can put the animals at risk, it can put your coworkers at risk. So it can be quite serious.
So there are general risks in the workplace, and we at 12 weeks generally announce a pregnancy when you have had that 12-week scan and what you feel is now you're out of the risk stages of early pregnancy. But there are times, obviously, in early pregnancy where you may be exposed to high risk situations in a practice or things that you feel are high risk. And then when you are suffering a loss, these are the kind of things that can be so compounding because you're concerned that this is your responsibility. Can we discuss some of the risks in the practice that you have to be aware of, or you need to, or that perhaps that people are not aware of when you are pregnant at any stage, but particularly early pregnancy?
Mm-hmm. I think that in my experience, at least, there was a lot of risk factor that I wasn't aware of. Now, there's common risk factors that most people would think. Anesthetic gases is one. Making sure that the scavenge system in your clinic is, up to snuff, and making sure that all of the safety precautions are taken care of. Sometimes these things can get missed or not be up to date in the smaller practices, which can increase your risk of miscarriage. Radiology, obviously, we know exposure to radiation in pregnancy is not ideal. So being able to have someone else step in and do x-rays for you if you're able to do that. I mean, it's different in human medicine because they're able to say, hold still and then go behind a divider. Whereas, in veterinary medicine, we are, we're in there with our hands trying to position correctly. And often we need to retake multiple views because of, a wiggly dog or what have you. So those risks are more of the commonly known ones. There's also the risk of zoonotic diseases. So if you're dealing with, toxoplasmosis is one, listeria is one. There is a lot of zoonotic diseases that can compound that pregnancy risk factor for miscarriage if you're not taking proper precautions. And then also in medication, there was a medication that I was handling at an emergency clinic that I was working at that I didn't realize until I had started to do some research was actually extremely high risk. And we use it in veterinary medicine a little differently. It's a stomach protectant, but in human medicine, it is actually used to have an assisted miscarriage. So it was eye-opening to me to realize that the clinic that I was working at didn't really have anything in place. There wasn't really any sort of education around, what modified duty should look like or what high risk activities in the clinic need to be taken into account when someone knows that they are early stage pregnancy. And the fact that all of these, compounding risk factors are in the clinic really makes it vital that you need to disclose your pregnancy basically as soon as you find out, which obviously you're still in the high risk category where 1 in 4 women can have a miscarriage in their first trimester. So that in and itself is a very vulnerable position to be in because you want to protect yourself, you want to protect your baby, but it is requiring you to kind of go outside of your comfort zone and risk talking about things that you may not be comfortable talking about.
Absolutely.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
I mean, do you think that there should be policies in place, and this is something that there should be a discussion that you have to say, please, if you're employed in my practice, for example, and you do fall pregnant, please feel free to come and discuss it with me. Let's try and put some of these measures in place to better protect you.
Yes, I definitely think that policies should be in place. They should be openly discussed. It should be well known to everyone who works in the clinic what these policies may be or that they have them. You should have the freedom to be able to disclose your pregnancy to your supervisor, your practice manager, your owner DVM, and have the confidence and knowledge that it's not going to become, office chatter, that, you're technician friend or your CSR friend isn't going to get bent out of shape because they have to pitch in and, hold for x-rays or, do that dental surgery that you were, slotted to do because of the risk of the isoflurane gas. It should be something that is just second nature to a clinic, just like any other, PPE, protection protocols, any other risks that we mitigate in a veterinary clinic, and there are many. It should be openly discussed and not something that's overlooked, which I find, unfortunately, it often is.
So what kind of roles can colleagues play in reducing sort of the sense of isolation, particularly if they're not aware?
Definitely. And I think that, not everyone, unless you're in the position, you don't really think about it. Like myself, before I was actually in the position of being in an early stage pregnancy, working at the emergency clinic, it never occurred to me that there were all of these other risks that I needed to be aware of. And thankfully, my colleagues had previously gone through pregnancies and they knew of the risks and they were able to really help me with navigating those. But I think in order to be able to help people moving through early stage pregnancy or an infant loss, these risks should be something that are covered. If you have a staff meeting where you're like, this is the process, when you're handling a dog with parvo, if you're, handling cancer medications, these can be it should just be always talked about so that it's not taboo, so that you don't have that stigma associated with it, that it's not that, secret thing. I mean, obviously your personal health is private and is not something that should be openly discussed with everyone else or the team, but these are facts, right? The risks are facts. The fact that we need to handle those and have preventative measures in place are vital to the safety of everyone working at the practice, whether they are, going to have children at all or not. It's something that everyone should be aware of.
I totally agree. And what kind of response or gesture is, that's genuinely helpful when people are sharing that they've experienced miscarriage? So, which ones can actually really help and which ones can be unintentionally harmful?
Definitely. This one is very difficult to navigate. And I think that there are some people who are very comfortable talking about their loss. And I think that is great and should be the norm. But unfortunately, that isn't the case. So I think that if you are made aware of someone's loss and it's not directly from them, I probably wouldn't go out of my way to talk to them about it, because it can be something that's very difficult to speak on. They may want people in the clinic to be aware that they're navigating through this grief and trauma, but they may not want to talk about it. If the person does bring it up or if they are confiding in you, a common mistake can always be to put kind of a positive spin on it, where you would say, well, everything happens for a reason, or, you'll get them next time. And I understand that impulse, but it's really invalidating to that person's grief that they are trying to navigate. There really is no solace that they are going to take in knowing that, maybe they can have another child. It doesn't take the pain away. So just, validating them and saying, I'm really sorry that you're going through this. Is there anything that you need? Can I help you in any way? That large dog that, isn't particularly friendly is coming in for a nail trim. Why don't I take that for you? Or, if you are close with the person, which I've been very lucky to be very close with a lot of my colleagues, you can offer to drop off a casserole or, help in some way around the house, just so that they feel supported and like you're there for them.
Do you think that we are really practiced at suppressing and just getting on with it? And there is hopefully now going to be a change in the way in which we're managing grief and just general mental health in the workplace.
I do. I think it's a generational thing, honestly. I am a millennial to age myself, but I think that the experiences that I've had with the younger generations is that there is more emphasis on mental health. Mental health is health, that there is more acceptance. There's the ability to be able to talk about things more openly without that stigma. But the fact is that we're all going to be working with, folks of my generation, Gen X, boomers even. It's the thing is that stigma still exists. So it'll be interesting to me how the more kind of suppressed generation moves through this younger generation who is coming in, who isn't afraid to talk about it, who is able to give a voice to these feelings and to understand the gravity of a loss like this to someone's mental health.
So how can practice leaders and managers become better equipped to support staff through miscarriage?
I think having, like you said, a protocol in place, some kind of outline, informational thing in the employee handbook, informing of risks, talking about, modified duties or how to mitigate those risks, offering a pathway to disclosure so that they don't feel like, okay, who am I supposed to tell that I'm pregnant so that I can, modify my duties as needed to reduce my risk? There should be something that is readily available to all, regardless of their ability to have children. It should be in the handbook. It should be something that's talked about in orientation or onboarding with new team members. It should be resurfaced at staff meetings just occasionally. If you're going through, general housekeeping as far as protocols or safety measures, which you do quite often in a vet clinic, it can be nice to just make it one of the other things that is kind of covered so that it is not got that stigma surrounding it.
So if you could design a simple workplace policy around pregnancy loss, what would it include? What are some of the things I should include if I would want to put one in place?
I think it would depend on your clinic, but I would obviously outline the risk factors that are happening in the clinic, and then also what mitigating steps would be taken in order to reduce your interaction with anesthetic gas or radiography, these things. So you would want to outline it very factually, and then you would want to clearly state what accommodations the clinic is prepared to make at what stage of pregnancy, depending on risk and depending on what the clinic is able to do. I mean, ideally, you would be able to swap out with another technician, as I said, to be able to take the radiographs, to be able to do those dental prophies where you're right there with the gas. But that's not always able to be the case when you have very small practices or you're the only, technician that is able to do those things. There may be other options for you. And I think depending on your staffing ability and the clinic setup, the mitigating opportunities will be different. But I think having something in writing very clear like that, outlining the risks, what we're able to do here at this clinic, and then also outlining what would be the steps to disclosure. So who you would tell, what that would mean. So you would tell the practice manager, this would be kept confidential, for this amount of time, unless you choose to disclose it, making it very clear so that there's no guesswork. It's the worst when you're really unsure of, how are they going to react to me telling them that I'm pregnant? Is everyone going to be upset with me? Is everyone going to find out? Is this going to be, water cooler conversations, right? So it needs to be really, really clear.
And do you think women are concerned about being worked out, or do you think that they feel like they're going to be isolated because they're not contributing in a way they previously had? Where do you think some of these challenges come from?
I think, again, like you said, it's the resilience, right? Resilience is great, but there's a time when we need to stop pushing through and being resilient because it can be damaging in the long run. And I think that there is definitely the fear of being pushed out or not feeling like a contributing member of the team. There can be some animosity. There can be some fear of letting down your coworkers. As I said, I mean, it's a hard job working in a vet clinic. There's a lot of moving parts. It's very physical. It's mentally, emotionally taxing. And you get really quite close to your team that you're working with. And it can be difficult to watch them, struggling or doing the things that you would have stepped in and assisted with, or you would have taken lead on. But because of these risks, you do have to take a step back. But the understanding is that this is temporary. And when you step back and really look at the gravity, that this is, your child that you're carrying and what these risks could mean to that child, I think if these are openly discussed and these are known, it makes it easier for you to be able to say, no, this is a legitimate risk. Like we're science people here. So I think that, if people understand, there would be less of that kind of animosity or feeling that you're not a contributing member of the team.
I agree. How does miscarriage intersect with the wider challenges that women face in veterinary medicine, like balancing career and like your family planning or even having children?
I mean, it's not easy, that's for sure. I think that there's always the fear. I know when I disclosed my pregnancy, I was very nervous at what the practice owner was going to feel. I didn't know if he would be upset because obviously you're counted on in your position, right? You take pride in doing a good job. You love your job. You love the animals. You love the people. And the last thing you want to do is let anyone down. But that being said, this is your chosen career, and your personal health and your family health matter just as much. And being able to really have that work-life balance that we talk about so much, that I think is very, very difficult for veterinary professionals to actually achieve. I think that that's extremely important to have the perspective and to be able to support our colleagues. Right? I mean, if you do see someone having some modified duties, you don't need to make a big deal of it. You can just accept it at face value and be a team player. And, you may find out in 3 months that they're expecting.
Absolutely. And have you, from your experience, seen a difference between how men and women in the profession engage with conversations like pregnancy, miscarriage, and the kind of support that they provide?
I think so. But I mean, I hate to make assumptions based on gender because there can be women who are very understanding and very supportive and men who are very uncomfortable and do not want to speak about it. And then you can have the exact opposite. I've experienced both. I think that the most negative thing that I went through during my pregnancy and return to work after having my first child actually came from a woman. So that being said, I think that it really depends on the individual. And my hope for everyone is that they are working for someone or with someone that can see them as a human and be able to be supportive and understanding in this situation.
I totally agree with you. And outside of the workplace, dealing with it beyond just within the practice, how can friends or family members better support someone who is in the veterinary field going through a pregnancy loss?
I think it's very difficult. I think just really being there for them is the key, and offering them, a resource to be able to talk about it, because there's this stigma. It's not something that people feel like they can openly bring up. It's almost like you don't want to make things awkward for people by bringing up this really terrible thing that you're going through. But I think that in order to be able to heal, you need to have that community to support. And like I said, just offering, I'm really sorry that you're going through this. What actually inspired us to co-write the article together was the exact same thing, was Jackie and I having that conversation and being able to, commiserate about going through it and how difficult it was, and finding that support in someone who has experienced a similar loss or knows of someone who's experienced a similar loss sometimes can be helpful. And just like the end of the article says, you're not alone in this. You're really not alone.
Absolutely. I mean, I think we're probably so unaware of how many times this happens, and the fact that, just a comfort or holding space for these poor women would make such a difference in their lives.
Definitely. I mean, if you look at how common, redheadedness is, they estimate it's between, I think, 4 and 6%. And for women in the early first trimester of pregnancy, the miscarriage rate is 25%. So really, more people have gone through this than you would think.
That's crazy. I had no idea the stats were as high as that.
Yeah,
I think that's really important to note. And for those going through pregnancy loss and who've experienced this, can you provide them with any comfort or any advice on how to get through this, or any support groups that you can direct them to?
I think One thing that I would say is that this is not your fault. That's why I try to, as often as possible, use the term infant loss, because to me, miscarriage denotes blame. It the guilt that you feel because this happened to you when you know you didn't have control over what happened, but it still feels intensely guilt ridden when you experience something like this. So knowing that it's not your fault, that this is something that happens to a lot of people, it's just the fact that we don't talk about it that is so isolating. So if you're comfortable, feel free to talk about it. Don't worry so much about making things awkward for other people, because it's important. You might not be making something awkward for someone. You might be giving them an opening to be able to talk about their experience. And having friends and family that can support you is key. And there are always external resources if you need someone to talk to. There's always counselors, therapists. You can always reach out to your doctor too.
And for those who have experienced it silently, is it ever too late to start talking about it?
No, not at all. I personally, when I went through mine, I did not talk to anyone about it. There was only a few people at work that knew. As I said, the story about, crying in the back room with the freezer, that was mine. That was something that I went through. I didn't talk about it. I hid it as best I could because of that shame, because I didn't want to be, that person. And since I've gone through that, I've had experiences where other people have been more vocal about it. And it's been really inspiring to me.
I mean, you made the comment that obviously we are now facing a new generation of vets who are coming in with better understanding of general mental health as a topic that maybe it's being taught or covered better at university. And certainly I must say, my generation, I still find it quite difficult to comfort and provide the right words. It takes additional effort and practice. How do we get better at doing this, particularly when it's not something that comes naturally, or we haven't had any sort of education, or I know that even as parents, possibly, that we are learning to reparent and manage our children in a way that we were never raised in that way. So this is something that resonates through all stages of our lives, and then has a knock-on effect to these kind of situations.
Definitely. I think the most important thing for me is when you're having a conversation like this, or even dealing with your children in this way, is taking it outside of yourself, understanding that what they're saying is an expression of them, an expression of their needs, of what they've gone through. It's not a judgment on yourself. It's not a reflection of you. It has nothing to do with you other than them looking for some support. You don't need to have something clever to say back. You don't need to be able to say anything really other than, I'm so sorry. That's all you need. Just being there for them is really key. You don't have to have, a pre-rehearsed or contrived plan in order to deal with stuff like that. I think that realizing that, even if you're uncomfortable, recognizing that it's not about you. It's really not about you. And just being there for someone can be really, really impactful for them, whether you have the right thing to say or not.
I totally agree. And I think naturally, obviously as vets or nurses or in this profession, you want to be problem solving. So I understand that probably comes with great intention of being able to sort of say, oh, I'm sure next time it'll be fine, or, you give it another shot, or it'll happen one day. It may seem like a helpful comment, but it can just be so damaging and so devastating. And I think that level of awareness and this is why it's so important to have this conversation, because I think, those kind of words or comments cannot be taken back and can have such a profound impact on someone suffering a loss.
Mm-hmm. And they're so easy to make. And I do think that it is... a lot of them, they're not coming from a bad place, right? It is trying to make you feel better or put a positive thing on it, or a positive spin on it. But I think that ultimately the root of those comments where it's like, oh, you can always try again, or, everything happens for a reason. It might just be your discomfort coming through and wanting to put a positive spin on it, or to change the subject or not talk about it. I think that is kind of to me, I would suspect the root of where those comments are coming from when, as I said, it's not about you and you don't need to say anything. You can just be there for them.
Absolutely. And I mean, I totally agree. When we are dealing with heavy situations, a lot of emotion within the work that we do on a daily basis, from clients unable to afford particular treatments or not taking a path that we necessarily, emotionally agree with, or euthanasias and loss of our patients. Dealing with something on top, whether it's pregnancy loss or loss in general, can really make these sort of situations so much worse. How important is it that people work through a loss so that it doesn't affect you longer term? And is there a time frame that you need to do it in, or is this something that you work on slowly and at your own pace?
I think it is really situationally dependent. It really depends on what's right for you. There's definitely no timeline. I do feel like processing the grief allows you the freedom to be there fully in these types of difficult situations that we deal with so often in vet med. That if you haven't really felt the pain, if you haven't really unpacked the maybe potentially guilty feelings that you're having, or this loss, then it will bleed out into other things in your life. It can come out in multiple ways. It can come out in anger. It can come out in sadness. It can make you more sensitive to the difficult things that we're dealing with in clinic. As I said, where I was dealing with a difficult case, where working in emergency medicine, you deal with difficult cases all the time. We get, dogs attacks, and we hit by cars, and lots of very traumatic injuries. And normally I would be completely fine, but I hadn't dealt with the emotions of my own loss, which resulted in me not being able to control my feelings and not being able to be fully supportive to the family that had brought in their dog who had been hit by a car, because I was dealing with my own stuff. And I think that if I had taken the time to really process the grief, really, sit within my discomfort in order to move through it, that I would have been able to heal much quicker, and I would have been able to feel more confident in the job that I was doing in practice a lot faster than I did. And I don't think there's a timeline. I think it really depends on your personal feelings and how you move through the grief. And sometimes you can do the work, you can feel like you've made it through, and then it can jump out at you again later on. So it really depends. And I feel like dealing with grief and moving through and feeling your emotions and understanding their effects and impact on your mental and physical well-being is really a vital piece of working in vet med, because we're going to see some sad things. We are going to help people navigate through some very difficult cases with their beloved family members. And being able to not just stuff those emotions down and try to grin and bear it and get through the day is what is going to make the people working in vet med absolutely resilient.
Thank you for sharing that. I totally agree. That's so well said. In terms of people who are suffering loss, at what point do you seek professional help? Do you say that I can't do this alone and I need better support? What kind of signs would you?
If it is affecting your day-to-day in a way where, you can't get out of bed, or you're crying all the time, or you're having thoughts of self-harm, anything like that, I think warrants a conversation. And I feel like if you've gone through a miscarriage, typically you're under the care of a midwife or an OBGYN or a general practitioner. So there should be lines of communication. There should be someone who is able to check in and find out how you're doing. But that's not always the case. And medical professionals are very busy, and sometimes things can slip through the cracks. So being able to advocate for yourself and to recognize when things are not okay, and being able to reach out and say, hey, I really could use some professional support, whatever that may be, I think is vital. And being able to really reflect on one's own mental state and understand where things are not getting better, that you need to act.
Thank you. I've really, really valued this conversation. I think it's so important. I'm so appreciative that we've had it. But Heather, on closing, I know we are running out of time, and I would love to continue to converse with you because this is such an important topic. And I think if people want to reach out and have particular questions for you, I'm going to encourage them to do so, and just direct questions, and we will try our best to answer them. But if there's one message you'd like every listener, whether they've experienced miscarriage themselves or whether they're supporting someone who has had one or has to carry this with them, what would it be?
I think for those who have experienced it, I would just say you're not alone, and don't be afraid to talk about it. I think there is so much value in community and surrounding yourself with people who will support you no matter what. And for those who have not experienced it and may never experience it, I think being informed and aware of how difficult it is to navigate through early pregnancy and especially infant loss is compounded in our industry. And it is something that needs a spotlight on it. And we need to have more policies around it. It needs to be openly discussed. And I think if anyone out there is motivated to do that in their practice, then I feel like we're taking a step in the right direction.
Well, you've certainly motivated me to look at that. I mean, it's something that we don't have in place, and it's a lack of awareness rather than, sort of an intentional leave it out. It's not important. It is so critical. So Thank you. Even if it's made a difference in our practice, it's much appreciated. Thank you for your time. I really, really appreciate you coming and being so vulnerable. This is, I know, not an easy subject to discuss. You've written a beautiful article with your colleague, and I hopefully we can also provide listeners, if they want to read that, whether you're comfortable with us providing a link for them to do so, and just being able to gain some information, and this is hopefully will be a resource for them if they find themselves in need.
Mm-hmm, definitely. I would appreciate that. And again, thank you so much for having this topic on your podcast. I know that it's not something that people are openly talking about, and anyone who will shine a light on it, I think is making a positive difference in the industry for people who may experience this and for people who want to be able to support people who are.
No, it's so important. I have to confess, I'm a suppressor. I find it very difficult to talk about things like this. If I just put my head in the sand, it'll go away. I struggle to know how best to support people when they are at a loss. I'm like, what can I do to distract you rather than actually providing that space to deal with the loss? And so I'm learning. And so hopefully we can all learn together. So this has been really informative. Thank you, Heather. Thank you so much, Heather, for your openness and courage in sharing with us today. This conversation reminds us that while veterinary professionals dedicate their lives to caring for others, they also need care, compassion, and understanding themselves. To our listeners, if this episode resonated with you, please consider sharing it with a friend or a colleague. And if you've been through miscarriage yourself, know that you are not alone and that your experience matters. If you'd like to support the Paws Effect podcast, please subscribe, rate, and review the show wherever you're listening. It really helps these important conversations reach more people. I'm Dr. Cara. Thank you for listening. I'll see you next time. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.